What'd you think? It's a great pleasure.
Well, I want to welcome you all back. Judging from the mood of the room, this is a way happier group than it was a year ago. I don't know. I think it was the M&Ms that have cheered things up. Maybe it's a target that's $1.8 billion different than the last one we had, I do. So welcome to the Senate, and I'm glad we have the polo day on the House here. We're dressed appropriately for House functions. Welcome Senator Hann and all the staff here. Just an announcement to the members of the table. This is, if you lose these, the papers in here, that's all you get. So, pretty much. And in the back of your folder are numerically ordered amendments, which we'll take up later. Okay, then. She's just the bad cop, yeah. Anyway, is there people on the agenda today? This is out, right? Okay, good. So what my intention tonight is to actually do some work. We'll do the standard walk through the spreadsheet from both bodies, just so we have some familiarity with what both House and Senate have done with the money. And then we're going to walk through each article and adopt language that's easily adoptable with only technical amendments, House or Senate. We're not going to just do identicals. We'll do ones that we've sat down. We had some interim meeting times while you were all on vacation. We had some fine gatherings together without peanut M&Ms, however. And worked out a few things. And then we're going to take up 3 topics that are listed. And there is work being done on getting a global target. The House and Senate acted independently, pretty much as committees, in establishing the work that we did in each body. Since the House did its bill at the floor, the notice about the surplus in the HMO 1% money came around, and there's high-level negotiations about how much that will be allowed to spend, which will be resolved soon. Just a matter of soon, I'm sure. So with that, members understand pretty much what's going on? And that's all the M&Ms I have, so when they're gone, they're gone. There's only 23 pounds. So perhaps now I can ask the fiscal staff to walk through the spreadsheet.
Mr. Chair and members, I'll be walking through the numbers in the base articles in both bills, and then Mr. Albrecht will go through the contingent article in the Senate. People should have a legal-sized document, 8 pages, labeled Health and Human Services Committee Net Fiscal Impact of Proposals. It's 3 groups of columns. The House columns are the middle set. The Senate columns are the right-hand set. And I'll just briefly identify the spending items for both bodies. Starting on page 1, moving to line 91 is the first item. The House has a expenditure relative to releasing a medical assistance lien. Going to page 2 on line 95. The House has savings relative to an item putting mental health physicians' assistance into MA, making them eligible for reimbursement. Line 99, the Senate has financing for a managed care study. On line 105, the Senate has an item on monitoring referrals to early intervention services. On line 109, the Senate has critical access dental modifications. Line 116, the Senate also has MA coverage for denture replacements. Line 123, both the House and the Senate have items relative to MA dental coverage for developmentally disabled individuals. Line 128, the House has an elderly waiver critical access provision to identify needs in the the elderly waiver program. Line 133, the Senate has money in the tails to exempt waiver recipients from co-payments and deductibles. On line 138, the Senate has an item relative to Medicare certification modifications for nursing facilities. Moving to page 3, line 52, the House has an item creating a PCA and waiver appeals process. Line 157, the Senate has funding for managed care reporting activities, audit activities. That bill is traveling separately in the House. On line 164, there is a Senate item on restoring emergency medical assistance coverage for dialysis patients. Line 172, in the tails, the Senate eliminates the long-term care consultation requirement. On line 179, there are a series of items in both houses related to adult foster care and group home changes. Line 179 is the first of the Senate items for that. Line 188 is the same in both houses and is related to community paramedics being eligible in MA. This bill has actually passed and been signed into law. We're just carrying the savings on the spreadsheet here. Line 192, well, we have to book them somewhere. Line 192, there is a nursing home construction moratorium exemption in both the House and Senate bills. Both houses do the same thing. They just take a slightly different approach to how much money is allowed in the exception. Line 196 is the second of the Senate's provisions relative to foster home certification and group home. Line 200, the Senate has some money for critical access nursing facilities. At the top of page 4, there are two items in line 204 and 213 relative to the contingent 1.67% cut. The House and Senate take slightly different approaches on line 204. The House delays that cut to the first day of fiscal 14. The Senate repeals the cut. And then down below on line 213, both houses shift the cost of that out of fiscal 13, so there's zero net impact on fiscal 13, and no cut will occur in fiscal 13 in either bill. Line 223 is the MAEPD changes. The House and Senate are the same on that. Line 231 is a House provision relative to community living settings. Again, this has to do with group home and foster care issues. Line 236 is the House's EBT card reform provisions. And a related item is line 243, which includes MFIP drug disqualification programming for disqualifications. Line 247, both the House and Senate have welfare fraud prevention initiatives, the main difference being the effective date on those and when the money, various costs occur. On page 5, line 261, the House continues the existing level of TEFRA fees into the next biennium. The Senate does not do that. Line 264, both the House and Senate have a earned income disregard program. The difference in the money there is just the House's is an updated number, but the provisions are, I believe, the same. Line 269 is a House reduction in corporate foster care capacity. Line 273 is the Senate's line for refinancing TANF. Line 279, the Senate also makes an adjustment to the Healthcare Access Fund so that there's no impact on the Healthcare Access Fund. Line 285, the House is funding the Community First Choice option implementation. Line 290, the House has money in the tails for enhanced bed rate for the Teen Challenge program, additional beds. Line 295, the House has money to partially restore cuts to the Merck program. Line 299 actually shows zeros as a total, but it in the House provision repurposes money in the state-operated services special revenue account to extend the operations at the Wilmer Behavioral Health Hospital. On line 6, or page 6 rather, Line 318, there's an additional item on corporate foster care capacity reduction that the House did. There is on line 325, the Senate and House both have an item called improved capacity to meet long-term service needs that's also related to the corporate foster care issue. Line 332 is a study that the House puts in place on return on taxpayer investment. Line 336 is a small change to the way DHS deals with child support enforcement. Line 340 is, lines 340, 344, and 349 in the House are all grants related to the Circles of Support Bill, Representative Lanning's Circles of Support Bill. Line 353, the House puts funding in for the FAME program that was defunded last year, I believe. Line 357, there is funding. The House increases the child care differential rate for accredited child cares. And then line 364, the House and Senate both buy back some of the absent days that were cut. The House buys back all of the absent days. The Senate buys those back for school-age recipients who have children. Page 7, line 372, the House has a mentoring pilot project for the MFIP program. Line 376 and 380 are both related to long-term homelessness in the House provisions. Line 384, both the House and Senate put money towards the intractable epilepsy program run by People Inc. Line 388, the House puts out some one-time funding for the Advocating Change Together program. Line 400, the House funds $100,000 for the Aliveness Project one time. Moving down to the Department of Health, the Senate on line 412 has a health coverage mandates evaluation that's funded. Line 416, the Senate funds a radiation therapy facilities capacity study. This bill is also moving separately in the House. Line 420, the House has a study continues work on evaluation of regulatory functions, work that was started last year. On page 8 at the top on line 424 is the Senate's item transferring HMO regulatory activities out of the Department of Health. Line 435, the Senate and the House both have a study of for-profit HMOs. Line 439 is the administrative cost related to the nursing home construction moratorium exception I mentioned earlier. The costs are at DHS, but the administrative cost of the group, the working group that makes the decisions, are at the Department of Health. Line 443, the House funds an autism study. Moving down, the Senate on line 494 has costs at the State Nursing Board for the Nurse Licensure Compact. That bill is also moving separately in the House. Line 573 are the Senate's provisions transferring HMO regulatory activities into the Department of Commerce. And then finally on line 587, the Senate has an item for the Emergency Medical Services Board. And Mr. Chair and members, that's the base funding in both bills.
Go ahead.
Mr. Chair and members, I should point out one thing that I'm sure Mr. Berg is not aware of, that on the spreadsheet we've just been going over on the last page, on line 583 in the section for the Department of Commerce, that's actually a separate provision that happens to also be with the Department of Commerce in the Senate's bill relating to the health coverage mandates evaluation. And now, members, also in your packet is a sheet that looks something like this, that shows the appropriations that are in the Senate's contingent appropriations article. On line 7 is the total amount, which is $21.9 million. The items, excuse me, begin on line 92 with a Senate provision for an autism residential campus planning grant at the Department of Human Services. Line 100 would delay the remainder of the PCA relative care reduction that has not already been delayed in the forecast. Line 109 is restoration of the remaining portion of the emergency medical assistance coverage for cancer treatment and the administrative money for that purpose. Line 117 is the governor's proposal relating to essential community support grants. Line 121 would repeal the fee-for-service rate reduction enacted last year for those providers. For the last year, that was a one-time reduction. Those tails are just related to the fact that there are payment delays for those providers. Line 126 is a provision that would, let's see, what is this one? This is the one that changes the reduction that was made last year. And on line 133, this is the one that changes a 10% reduction to a 5% reduction for congregate living lower needs folks. And Mr. Chair, that's the end of that item.
Well, thank you. And I think one thing to also remember as people look at this, the contingent list is contingent for two reasons. One is the exact denomination that's coming from the HMO is not clear, but also the timing is not known. And so as we spend this, we want to be aware that if we need money July 1st, this may not be available then. Mr. Albrecht, do you know is there an estimate about when this might come?
Mr. Chair, I've heard as much as several months.
Several months, okay. Anyways, that's just a thought about that. Any members from, any questions from members about the spreadsheet, House or Senate? Okay, good. I think that's productive to go through that, and it's still important to point out the denomination, what digit we're working in here compared to what we were doing a year ago at this time. So at this point, we're going to go through the various articles and discuss and adopt some language. Start with Article 1. And Mr. Chun, let's see, we have here.
Mr. Chair and members, Article 1 is the healthcare article for both bills. You'll have two pieces of two documents in your folder for each article. One is the actual comparison bill with the House language on the left and the Senate bill language on the right. And then there'll be a document called Bill Summary Comparison of the HHS bills, again with the House language on the left and the Senate language on the right with the staff comparison in the middle. So and I'll work primarily off this comparison summary. Starting with House Section 1, this exempts individuals enrolled in the Minnesota Care Defined Contribution Program from the 6-month residency requirement under MSHA. This is a House-only provision.
Most of us don't have the actual language on Article 1. We just have the side-by-side. Over here, I don't know.
We can share with you if you like.
You don't have mine? No. I have it, but I bought it from home.
I have Article 2.
I want both, but I don't have Article 2.
Neither does Sean.
I never argued with it. What are they called?
I don't think I have Article 5 either. I can't find Article 5 either. It's 7:06.
Oh, and also, while those are being passed out, I believe all the amendments are online. Ms. Keel is, those are all online, right? And so the House technology allows for that. And it's going to be our intention to put most of the amendments we can online, unless they're late, and then they'll be paper. And eventually they'll be online after they're adopted through some miracle of technology. So don't ask me to do that. Okay, did you describe Section 1, Mr. Chung?
Sure, I can start it.
So just if you want to just read the header of it. It's our intention to adopt a number of these sections tonight with not a lot of discussion. So if members have questions, they would like to raise your hand relatively soon. I know members have all read their own bills, and I know that my members were given copies of the Senate bill to look over. And I presume the Senate's done equal preparation. But if there's questions, we're happy to spend the amount of time so members understand. So maybe just want to read the title of each one so people can know what we're working on, Mr. Chun. You probably did that already.
House Section 1, this is the waiver of pre-existing conditions for the Minnesota Defined Contribution Program, relates to the MSHA residency requirement.
Do you want to move that?
You want to go through the whole...
No.
Yes.
So you want to just adopt them as we go forward?
Yeah.
Mr. Chair,
Yes. Senator Hann.
I would move the adoption of this provision.
Any questions? All in favor, say aye.
Aye.
Opposed? And Mr. Chun, the next three sections, I just want to announce some good news about that. This was the pre-authorization thing with the physical therapy, OT, et cetera. And the commissioner and the individuals affected by these pre-authorizations had a very productive meeting last week and have come to a resolution that's very favorable, and I commend the department for being so responsive to this really big challenge. This pre-authorization has been suspended, I think, for a year. Is that right? Yeah. Retroactive to July. I got that right. So while they retooled this, and this was, nobody intended this to be so rough, but it has been, and so I'm glad they could get that agreement. So we'll not be asking for any action on sections 2, 3, and 4. Okay. So maybe Mr. Chun, if you want to, so that's just something to celebrate. Actually, it worked out.
So it's out?
No, we just don't adopt it. They just sit there. And so now we'll move on to, you want to describe section 5.
Mr. Chair, House Section 5, Senate Section 1 deal with MA dental coverage for adults. The difference is that the Senate adds coverage of repairs to removable prostheses, and the Senate adds an additional covered service, which would be prophylaxis.
Okay, and that has money, so we're just going to sit on that.
Okay.
So we're just, but still, I think it's good to go through the provisions so we can have those.
Sure. And Mr. Chair,
Mr. Chun,
the next set of sections, House Sections 6 through 10, relate to non-emergency medical transportation. Section 6 establishes an advisory committee and assigns duties. Section 7 specifies the membership. Section 8 requires the Commissioner to implement a single administrative structure for non-emergency medical transportation. Section 9 requires establishment of a standard assessment process for enrollees. And Section 10 requires the establishment of performance measures.
Okay.
We're not back on Section 11.
Well, we're on 6 through 10.
Mr. Chair, I'd like to move the adoption of the sections 6 through 10, and I think Section 11,
That's a difference.
that's a difference. Okay.
So any questions about that? Seeing none, all in favor, say aye.
Aye.
Aye. Opposed? Those are adopted. And Mr. Chun.
Sure. House Section 11 deals with physician assistance services. It provides MA coverage for certain inpatient mental health services.
Yeah, let's do it.
Okay, well, that's got money, so we'll just sit on that, so that's fine.
Then House Section 12, the paragraph A sets the payment rate for these physician assistance services. Paragraph B deals with the prior authorization issue that you just brought up, so I think you can not act on paragraph B, which is for mental health. Then House Section 13 and Senate Section 2. This is the MA coverage for community paramedic services, which is traveling as a separate bill.
And so will not be adopting that
It's
section.
already been signed.
Right, so we won't be moving that section. Mr. Chung?
Yes. The next section, this is a Senate-only section. Senate Section 3 permits a health plan to waive the required family deductible under MA. There is a Senate amendment. It is the SCH 2294A37 amendment, which is in the green plastic file folder in your packet.
Okay, let's take that up then.
And this is just some clarifying language suggested by the Department of Human Services for this section.
837. 837. Senator, do you want to move to 837?
Mr. Chairman, I move the adoption of the 837 amendment.
Do members have questions about this? Seeing none, all in favor of the 837, say aye.
Aye.
Aye. Opposed? It's adopted. Are we going to adopt this? No, the amendment. No, we adopted. We amended this section. So, yeah, right, you want to move Senator, you want to move to adopt that section? Okay, you can move.
There's no money.
There's no money.
Mr. Chair, I move the adoption of Senate Section 3.
Everybody understand that as amended?
As amended.
Everybody understand that? All in favor, say aye. Aye. Opposed? Adopted.
And, Mr. Chair, House Section 14, this requires DHS to implement a pediatric care coordination program for children with high-cost conditions.
And does that have money tied to it yet?
Mr. Chair, no, I don't
Open for
believe
big
it has
savings. Okay.
I know.
Senator, that's got no money tied to it. So
No, I
you don't know.
Brad.
Mr. Chair, I would move the adoption of House Section 14.
Wait. Pediatric care coordination. I'm still hoping this will yield some money, but it would be savings if it was anything. So everybody understand that? All in favor, say aye. Aye. Opposed? Thanks, that's adopted.
Mr. Chair, the next section, House Section 15, this provides a nursing facility rate adjustment for facilities that participate in healthcare delivery system demonstration projects.
And this is tied to emergency medical assistance, and so we'll just sit on that for now. It's part of a bigger project, so we'll hold on that.
And the next section, House Section 16, Senate Section 4, these deal with performance targets for HMOs and county-based purchasing plans. The language is identical except for technical differences on which the staff would recommend the Senate.
So, Mr. Chairman, I would move the adoption of Senate Section 4.
Everybody understand that? All in favor, say aye. Aye. Opposed? Adopted.
And, Mr. Chair, House Section 17, this is House language that increases payments to the Merck Fund from HMO capitation rates.
I'll wait on that.
And I think people are hoping to adopt that, but we'll have to sit on that for a while. So.
Then the next section, House Section 18, requires health plans to report to the Commissioner on the extent to which they use, to which their providers under contract use patient-centered decision-making tools.
That's Section...
It's House Section 18.
no. Section 18, correct.
Section 18.
Yeah. Mr. Chair, I'd move the adoption of House Section 18.
Everybody understand that? All in favor, say aye. Aye. Opposed? Thank you. Mr. Chung.
Sure. Senate Section 5, this deals with financial audits of managed care plans, and House File 2412 is on the floor.
And Senator Hann, Representative Gottwald, we're not going to do this tonight, right? This is a little, okay, we'll discuss that in its own special time. So. Okay, Mr. Chung.
Then the next section would be Health Section 19, requires DHS to require the health plans to implement strategies to reduce the incidence of low birth weight in certain geographic areas.
I think we want to adopt. This does not have cost to it.
Right.
Mr. Chairman, I would move the adoption of House Section 19.
Everybody understand that? All in favor, say aye.
Aye.
Opposed? Thank you.
And, Mr. Chair, House Section 20, This makes the current competitive bidding project for managed care ongoing.
And Mr. Chair, I'd move the adoption of House Section 20.
And makes it permissive. So, everybody understand that? All in favor, say aye. Aye. Opposed? Thank you. Mr. Clem.
Then moving, excuse me, to Senate Section 6. This provides the critical access dental payment rate for certain services provided at an off-site private dental office.
And that has money, so we'll hold on that.
Then the next section is Senate Section 7, relates to volunteer dental providers. There is a House file, or I should say that a bill has passed both floors, so you can, I think, hold off on that.
Right, and was this signed or just concurred with? I think? Okay. Yeah, we'll hold on that. That might not have to be here at all, so. Mr. Chung.
The next section, I guess sections 21 to 24, deal with the Minnesota Care Defined Contribution Program. They, I guess, incorporate changes that were suggested by the Department of Human Services to how better implement the program.
And there's no cost, is that right?
No cost to that.
Mr. Chair, I would move the adoption of House Sections 21 to 24.
Everybody understand that? Any questions? Seeing none, Representative Gottwald. All in favor, say aye. Aye. Opposed? Thank you.
Mr. Chair, then House Section 25, Senate Section 8. This is the sort of the managed care withhold language for the Minnesota Care program. Again, just technical differences on which the staff recommend the Senate.
See a trend in staff recommendations. Senator Hann.
Let's see, that's Senate Section 8, is that correct?
Yes, Senator Hann.
And, Mr. Chair, I'd move the adoption of Senate Section 8.
Everybody understand that? All in favor, say aye.
Aye.
Opposed? Thank you.
Then the next section is House Section 26. This requires DHS to provide a methodology and draft legislation that would allow the release of data on claims and utilization to research institutions and other entities.
I think we'll hold on that right now. Mr. Chung.
Then House Section 27. This requires the Department of Human Services issue RFP to develop and administer a care delivery management system for MA fee-for-service enrollees.
Okay, that's money. Does that have money attached to it?
Oh, did it cost money?
Yeah, I think so.
I believe there is money attached to that
hold on.
section.
Sorry.
The next section is House Section 28. Requires the Commissioner to issue a request for information from vendors for solutions to manage non-emergency medical transportation.
Mr. Chair, I'd move the adoption of House Section 28.
Everybody understand that? All in favor, say aye. Aye. Opposed? Appreciate your enthusiasm. That's good. Mr. Chung.
Then House Section 29, this is a working group related to coverage for physician assistants, so it's tied to a section with money.
Do we want to wait on that?
But it doesn't have money, though.
No, I believe that this particular section doesn't have money.
Well, then, okay. Mr. Chairman, I'd move the adoption of House Section 29.
Everybody understand that? All in favor, say aye. Aye. Opposed?
And, Mr. Chair, the next section, this is House Section 30, requires the Health Services Advisory Council to review literature on autism treatments and make recommendations to the Commissioner.
For now, let's hold on.
Okay, let's hold on that.
Then the next section, Mr. Chair, is Senate Section 9. This is the MA coverage, or coverage of dialysis services under emergency MA.
And that's money.
Right. Then Senate Section 10, DHS is to develop recommendations to implement a revised cost-sharing structure for state health care programs.
And that has money tied to it as well. So let's sit on that.
Sure. And then Senate Section 11 requires the Commission to contract for an evaluation of the value of managed care for public health care programs.
And that has money.
And the final section is Senate Section 13. This repeals the requirement that HMOs participate as providers in state programs as a condition of certification, and also would repeal the Rule 101, which is the state program participation requirement.
I think we'll hold on that one. Sorry to disappoint everybody. So close. Article 2.
Mr. Chair and members, for Article 2, that's the Department of Health article, and I'll be working from the side-by-side, the summary side-by-side.
Okay. Okay. Go ahead.
Mr. Chair and members, Sections 1, 2, and 3, and Senate Section 17 are all related to the transfer of HMO regulations from health to commerce. They're identical except for the fact that there's different effective dates, and the House doesn't have the reviser's instruction, which is Senate Section 17.
And we're going to hold for that now. There's an amendment for that that's not technical. So we're just doing technical amendments. Oh, there's money.
Yep.
Okay.
Money.
I think the amendment.
Mr. Chair and members, then House Section 4 and Senate Section 4 are identical. This is the community-based health care coverage program provision.
And, Mr. Chairman, I think I would move the adoption of House Section 4. We'll give you a chance to take something into bill.
That's very kind of you. Thank you. Any questions about that? Alrighty then. All in favor, say aye. Aye. Opposed? Thank you.
Mr. Chair and members, then House Sections 5 through 10, Section 17, and Senate Sections 15 and 18. I can go through those again. They're all related to the PPG changes and the community benefit rider, which has already, passed into law and is Chapter 164.
So we'll drop them from this bill, and congratulations to those people who worked on that and solved this very contentious problem. So good job. So we can celebrate that as a moment here. Ms. Cleveland.
Mr.
no
Chair
more
and members,
moments.
then the next section is on page 7 of the summary side-by-side. It's House and Senate Section 11. This is an exemption from the swimming pool regulations for a naturally treated swimming pool in Minneapolis. There's different approaches here with the same result, and I think the Senate provision is the one that is a bit cleaner.
A bit cleaner. Is that Senate 11 too?
Senate 11, yeah.
Mr. Chair, I'd move the adoption of Senate Section 11.
So the cleaner version. All in favor? Everybody understand that? All in favor say aye. Aye. Opposed? That's adopted.
Yeah, it is.
House Section 12 is a House-only provision here. There's a Senate File 1811 moving in both houses, and this is related to the Advanced Diagnostic Imaging Services.
Wasn't that in your consent calendar?
I think we have an amendment too.
Oh, so we should adopt it here.
There's a A139 amendment.
It's been passed off the House floor and the Senate floor. There may be, I don't know if the Senate's going to pick it up and pass it, but it's still in that, it's not passed yet.
You want us to adopt it into this?
I would rather you would, and then...
Okay, that's fine. And there's an amendment then?
Take an action later if it's actually...
Sure. We can amend it twice.
Mr. Chair and members, then the A139 amendment, which should be in your packet, puts this language in the same form as the one that has passed the floor.
It's right here. So Representative Kiffmeyer would like to move that.
I don't think I have that amendment.
What?
A139. A139. Go ahead. 139. They're in order.
Oh, there it is. Mr.
Representative
Chair.
Kiffmeyer, do you want to? No. Representative Kiffmeyer, do you want to? You can move the amendment then if you like.
Okay. Well, Mr. Chairman, I haven't got it. Is this the Senate language?
Yes.
Mr. Chair and
Sorry.
Representative Kiffmeyer, that language is the language as it's passed the House floor, which was the Senate language. So that all matches if you adopt that amendment.
Right. Okay.
So Representative Kiffmeyer moves the A139 amendment?
Yes.
Everybody understand that? Actually, and so we have to adopt the amendment, then adopt the section. So all in favor of that, say aye. Aye. Opposed? That's adopted. And then Senator Hann, do you want to? move House Section 12?
Mr. Chair, I would move the adoption of House Section 12 as amended.
If I understand that, all in favor say aye. Aye. Opposed? That's adopted.
Mr. Chair and members, House Section 13 is house-only provision related to the cost of copies for health records and the SSI exception.
And Mr. Chairman, I would move the adoption of House Section 13.
Everybody understand that? All in favor say aye. Aye. Opposed? That's adopted.
House Sections 14 and 15 are house-only, and they're related to the patient consent to the release of health records and the liability for unauthorized access.
Yeah, I think we're going to have some testimony in this later, so let's hold on that for right now.
Mr. Chair and members, then the next section is Senate Section 12, and Senate Section 16 goes along with it. That's the radiation therapy facility moratorium provisions. Senate Section 16 is the study, and that's on page 11. So there's a cost for the study, but there's not a cost for Senate Section 12. These are moving separately in the House, or both bodies, as House File 38 or 383.
Representative Gavel, do you want to act on this tonight, or do you want to sit on this? We have to amend this to make it conform, and the study needs language, but the moratorium thing does not. The study has money, right? We could adopt the...
Yeah, let's adopt.
We can't adopt the study. We can adopt the base bill and not the study, if you'd like. Is there an amendment to clean that up?
Yes.
Is that in our packet?
There is. It's a Senate Amendment A34. It should be in the packet.
Oh, A34? Yeah, it's right here.
And Mr.
Representative Gottwald, do you want to move the A34?
The A34 amendment?
Okay, so we're amending the Senate language. Okay, everybody understand that? So we're just going to adopt the moratorium. We're adopting Section 12.
What we're doing here?
Representative Gottwald, yeah, why don't you just announce what this is? This is actually kind of new to this committee, so go ahead.
This is language, we actually adopted this in Ways and Means, that seems like a year ago, but it was just the other night. What this does is it simply adds more detail to say that the lifting of the moratorium will be allowed to expire in the Twin Cities, and these new criteria that we put in place will take effect, but only in these counties. It was never meant to go statewide. There was some concern that the legislation as it was originally drafted was not clear about that, so we are now being very clear about that. There's peace in the valley. All sides in the matter have agreed to this, so I would encourage support.
And just to the public, there was no test. I was in the Ways and Means Committee, and nobody wanted to come down. Is that still true? You don't have to come down, but if you would like to wave your arm and come down, just to be fair, because this has been very contentious. Seeing no takers, everybody understand the A34 amendment? All in favor say aye.
Aye.
Aye. Opposed? Senator Hann, you want to move Section 12?
Mr. Chair, I would move the adoption of Senate Section 12.
Everybody understand that? All in favor say aye.
Aye.
Aye. Opposed? That's adopted.
Are we supposed to move the House section or the Senate?
Oh, do we? There is no.
We did the right one. Okay. All right.
We're doing the Senate. Senate leaves again.
Mr. Chair and members, then the next section is on page 9 of the side-by-side summary. It's House Section 16, Senate Section 13. They're identical, and it's related to the postpartum depression information being handed out at WIC sites.
Mr. Chair, I'd move the adoption of House Section 16.
Everybody understand that? All in favor say aye. Aye. Opposed? That's adopted. Ms. Cleveland.
House Section 17, again, that was one of the parts of the PPG, so we've already covered that. So the next one is House Section 18, which is a House only, and this is a continuation of work done last year, an evaluation of Health and Human Services regulatory responsibilities.
And that has money, so we'll skip that.
House Section 19 is, the language is in the side-by-side for this article, but the comparable language is in Senate Article 1, Section 14, and this is the study for the HMO, for-profit HMO.
And that has money, so we'll hold on.
The next section is House Section 20, which is House only, and this is reporting the prevalence of sexual violence.
Mr. Chair, I'd move the adoption of House Section 20.
Everybody understand that? All in favor, say aye. Aye. Opposed? Thank you.
House Section 21 is house only, and this is providing a regulation plan for licensed home care providers.
Mr. Chair, I'd move the adoption of House Section 21.
Everybody understand that? All in favor, say aye. Aye. Opposed? That's adopted.
Then, Mr. Chair, that's the end of this article because all the Senate sections on the last page have been covered.
The study.
Very good. Thank you.
Did you adopt the study? No, because there's money. Yeah, okay.
We adopted, yes, 20 and 21.
Not the study.
No,
Okay, so that's on hold still. Regulation. Yeah.
no. That's,
Okay.
15.
Here's my-
Or 16.
16 is on hold.
Okay.
Right, we did not adopt it. To answer to your question,
Okay.
yes.
3, is that right?
We are free?
This is Danielle.
I don't have it.
And if you guys want to go, if the staff wants to go back and forth, you can just go back and forth without assignment from me, so. I don't know who's starting out, so. No. Oh, hang on.
Are you going to go?
Okay.
Okay, go ahead.
Mr. Chair, members, the next article is Article 3 in both bills. It's the Children and Family Services article. House Section 1 is a house-only provision. It's related to child care provider rate differentials for accreditation. It modifies the list of recognized accrediting organizations, and then it also increases the differential.
Now, we're going to hold on the money part, but did this leave the floor? And
Mr.
is
Chair,
this-
yes, it did. It was in House File 2097, I believe.
And is it moving in the Senate as well?
Actually, Mr. Chair, I think we took up the Senate file, and that passed off the floor.
Also went to the governor then? But it's not been signed yet? Okay, that's fine. So we'll certainly hold on that then, so just making sure.
Okay.
Ms. Pinelli?
Mr. Chair, members, House Section 2 and Senate Section 1 are related to child care absent day policy. These sections are slightly different, and I believe there's money attached.
So we'll hold on that.
House Sections 3, 4, and 5, and Senate Sections 2, 3, and 4 are related to data sharing between the Department of Human Services, the court administrator, and the Department of Public Safety. This is related to welfare programs. The information that's being shared relates to drug convictions, multiple identification cards, and legal presence.
And that takes the money. So if we do the DRAS amendment, the money goes.
Thinking of women.
Ms. Pinelli, if we adopt the A150-1, does that become a no-cost item? Mr. Bird or somebody? Is there still money? Oh, it's in the tails, right? Because we actually, this changes the date, so pushes them all into the next biennium, the savings and the cost. Yeah, so we'll hold on that. So we'll should we hold the amendment till later? Okay, we'll amend it when we take up money. Section 4.
Mr. Chair, the next section is House Section 6.
Oh, sorry. Thank you.
Actually, House Sections 6, 7, 8, 9, and 10 are all related to EBT cards. These sections make various technical and other changes. I would point out Section 9 restricts the use of EBT cards to Minnesota and surrounding states.
So we can adopt,
Well, do these all need to be, Mr. Chair, do these all need to be adopted
No.
as a body, or can they be
they're all
separately
separate.
adopted?
But they're standalone.
But they're standalone. Okay. All right. So we could adopt, Mr. Chair, we could adopt sections 6, 7, 8, and 10, I believe. And so I'd move, Mr. Chair, that we adopt the House sections 6, 7, 8, and 10.
Everybody understand that? All in favor, say aye.
Aye.
Opposed? Thank you. Okay, Ms. Spinelli.
Mr. Chair, members, the next section is House Section 11, Senate Section 6. These are identical and it relates to general assistance earned income savings accounts.
So there's some small dollars, we'll hold on that.
Mr. Chair, the next two sections, House Sections 12 and 13, are related to the FAME program.
And those have money, right? So we'll hold on that. Is that right? Okay, we'll hold on that.
Mr. Chair, the next section is House Section 14. This is related to the grant program for early childhood programs, crisis nurseries, and parenting time centers, and it's just directing 80% of the funds to go to outstate areas.
Mr. Chair, I'd move the adoption of House Section 14.
Everybody understand that? All in favor, say aye. Aye. Opposed? Thank you. Ms. Spinelli.
Mr. Chair, House Section 15 is related to the GRH program, and it prohibits counties from negotiating supplementary rates with providers that don't make referrals to community services for volunteer or employment opportunities.
Senator Hann.
Mr. Chair, I'd move the adoption of House Section 15.
Everybody understand that? All in favor, say aye. Aye. Opposed? Thank you.
Mr. Chair, House Section 16 is also related to the GRH program, and it's providing a supplementary rate for the Teen Challenge program.
We'll have to hold on that. Ms. Spinelli.
Mr. Chair, House Section 17 relates to the MFIT program and persons convicted of drug offenses.
And there's some money tied to that, right?
Yes.
We should hold on that.
Mr. Chair, House Section 18 is also related to MFIP and vendor payment. It requires counties to cease MFIP vendor payments for rent to landlords when an assistance unit's housing unit has been deemed uninhabitable.
And we'll hold on that for now.
House Section 19 is a House-only section. It requires peace officers to report whenever a person is arrested and they possess multiple EBT cards.
And there was no cost for that? Okay, Senator Hann.
Mr. Chair, I'd move the adoption of House Section 19.
Everybody understand that? All in favor, say aye.
Aye.
Opposed? Thank you.
Mr. Chair and members, the next section is Senate Section 7. This modifies the Maltreatment of Minors Act and requires that a child who is under age 3 and is involved in a substantiated case of maltreatment be referred for screening under the Federal IDA Act.
Okay, that has some money tied to it, right? So we'll hold on that. Is that right? There's money? Is that right? Okay, we'll hold on that.
Mr. Chair and members, the next section is House Section 20. It modifies the membership and the duties of the Asset Development and Financial Literacy Task Force.
And
Senator Hann.
Mr. Chair, I'd move the adoption of House Section 20.
Everybody understand that? All in favor, say aye. Aye. Opposed? Thank you.
Mr. Chair and members, House Section 21 and Senate Section 8 are different. They both modify language in a rider from last year related to TANF funds.
We'll just sit on that then.
Mr. Chair and members, House Section 22 creates a grant program to promote healthy community initiatives.
We'll hold on that.
Mr. Chair, House Section 23 creates circles of support grants.
And we'll hold, that's money, so we'll hold on that.
Mr. Chair, House Section 24 creates the Minnesota Visible Child Work Group.
We'll hold on that.
Mr. Chair, members, House Section 25 requires the Commissioner of Human Services to analyze the differences in asset limit requirements across programs to establish a consistent asset limit.
Mr. Chair, I'd move the adoption of House Section 25.
Everybody understand that? All in favor, say aye. Aye. Opposed?
Mr. Chair and members, House Section 26 and Senate Section 9 requires the Commissioner of Human Services to report to the legislature on the implementation of the data sharing sections that were earlier on in the article.
And that has money, right? Okay.
And finally, Mr. Chair, House Section 27 is a reviser's instruction related to making terminology consistent related to the EBT cards in statute.
So we should adopt that. Okay, Senator Hann.
Mr. Chair, I move the adoption of House Section 27.
Everybody understand that? All in favor, say aye. Aye. Opposed? Thank you, that's adopted. Article 4.
I don't have Article 4 either.
Oh,
Do you have a sheet on that?
oh, we give that. We're not to share anymore.
We can do that.
Continuing care, this is the big article. We're doing good, huh?
Moving right along.
Okay, everybody ready for an hour-long specter? Okay, it's more M&Ms, and we'll dig in for Article 4. Ms. Spinelli.
Mr. Chair, I believe Mr. LeBeco is going to start.
Okay,
Mr. Chair and members of the committee, Article 4 is the continuing care article. House Section 1, Senate Section 1 modifies eligibility for electronic health record loan account. There's just some technical differences, and this is no money, and staff recommends House.
Mr. Chair, I move the adoption of House Section 1.
Everybody understand that? All in favor, say aye. Aye. Opposed? Mr. LeBeco.
Mr. Chair and members, Senate Section 2 is a Senate-only provision regarding hospital futility policy.
I think we'll hold on that for now.
Senate Section 3 actually has similar language in the House as a rider, and this is regarding the nursing facility moratorium project funding.
And that has money, so we'll have to hold.
Yeah, and staff does recommend the statutory language, but the money is different, so we'll
Okay, thank you.
pass on that. House Section 2, Senate Section 4 is long-term care services and supports reports. There's some differences, mainly technical, and we do recommend the House language, and there is no money tied to it.
Mr. Chair, I move the adoption of House Section 2.
Everybody understand that? All in favor, say aye.
Aye.
Opposed? Thank you.
Mr. Chair, members, House Section 3 is a House-only provision on housing with services contracts.
Mr. Chair, I move the adoption of House Section 3.
Everybody understand that? All in favor, say aye. Aye. Opposed? That's adopted.
Mr. Chair, members, House Section 4, Senate Section 5 is regarding the adult foster care home mental illness certification. There's some technical differences, and we do recommend the Senate language.
Mr. Chair, I move the adoption of Senate Section 5.
Everybody understand that? All in favor, say aye. Aye. Opposed? That's adopted.
Mr. Chair, members, House Section 5, Senate Section 6 regarding the licensing moratorium. We're going to be hearing testimony on this and other provisions, so I believe we're going to pass for now.
Right, thank you.
House Section 6 is a House-only provision on the application and annual licensing fees. This does have money tied to it.
Let's hold on that then.
Senate Section 7 on adult foster care home respite beds. This allows a fifth bed in adult foster care homes for respite services, and this is Senate only, and it does have money.
That costs money?
Yep.
Okay.
So,
Okay, let's hold on that.
House Section 7, Senate Section 8 is on adult foster care alternative overnight supervision. Similar provisions, but there's some technical differences, and we recommend the Senate language.
Senator Hann.
Mr. Chair, I move the adoption of Senate Section 8.
Representative Schomacher, any questions? Okay. All in favor, say aye.
Aye.
Opposed? Thank you.
Mr. Chair, I remember Senate Section 9 is the Senate-only provision on adult foster care homes, caregiver presence overnight. This limits or restricts the adult foster care homes when there's no on-site staff during sleeping hours.
Mr. Chair, I move the adoption of Senate Section 9.
Everybody understand that? So all in favor, say aye.
Aye.
Opposed? Thank you.
House Section 8, Senate Section 10 on consumer data file, that the two provisions are identical.
Mr. Chair, I move the adoption of House Section 8.
Everybody understand that? All in favor, say aye.
Aye.
Opposed?
And actually, the next two, House Sections 9 and 10, Senate Sections 11 and 12, on unlicensed home and community-based service providers and probation's officer and correction agents. Those are both identical as well.
Senator Hann.
Mr. Chair, I move the adoption of House Sections 9 and 10.
Everybody understand that? All in favor, say aye.
Aye.
Opposed? Thank you.
Mr. Chair, member, House Section 11 is a House provision only on the tougher contribution amount.
And that's money, so we'll hold on that.
Mr. Chair, member, House Section 12 is on state agency hearings. It's a House-only provision.
And there's some money, so we'll hold on that.
Senate Section 13, Senate provision only, as well as if you go down to House Section 18, Senate Section 20, as well as Senate Section 21. Those are all related to the long-term care counseling requirements, and those all do have money.
So we'll have to hold on all those, I guess. Okay.
Continuing, the next three sections, House Sections 13, 14, and 15, Senate Sections 14, 15, and 16, are all regarding the MAEPD, allowing people 65 or over to continue on the program. The three sections are identical. There's one technical difference that we do recommend the House, but this does have money tied to it.
Let's hold on that then.
Mr. Chair, members, House Section 16, House-only provision on PCA appeals.
And that has money, right?
Correct.
We have to hold on that.
Mr. Chair, member, Senate Section 17 is on reimbursement rates for special transportation. This actually has no money, but it's a Senate-only provision.
I think we were going to hold on.
Okay, we're going to... Okay, so let's hold on that, I guess.
Mr. Chair, members, Senate Section 18, Senate-only provision is on MA co-payments exceptions, and this does have money tied to it.
We'll have to hold on that then.
Mr. Chair, members, House Section 17 and Senate Section 19 is on the elderly waiver assessment and support planning. There are some differences. There is no money attached to it. It allows providers of elderly waiver and customized living services to provide input during assessments and reassessments. The Senate allows proposed providers to give input. The House allows persons and their legal representatives to be provided a copy of the provider's input in addition to the input provided to the assessor.
Senator Hann.
Mr. Chair, I move the adoption of Senate Section 19.
Everybody understand that? All in favor, say aye.
Aye.
Opposed? Thank you.
Mr. Chair, members, House Section 19 and Senate Section 22 on the customized living service rate. They're identical, but they do have money tied to it.
We'll have to hold on that then.
Mr. Chair, member, House Section 20, House-only provision on surface rate limits, and this does have money tied to it.
Let's hold on that.
Mr. Chair, member, House Section 21 and Senate Section 23 on the elderly waiver service rate limits. This is similar to above on House Section 17, Senate Section 19. And they're a little, again, there's some differences, and staff recommends House language.
Senator Lori.
Well, we skipped. I'm sorry, we skipped this House Section 18, Senate Section 20. I was just trying to follow, and then and Senate Section 21 as well.
Mr. Chair and Senator Lori,
those were covered earlier when we talked about. I see it.
Yeah, they have money attached.
With the long-term care consultation.
Correct.
No, the House language was,
There's money.
but that didn't have money.
And that's got money tied to it. Yep. Okay, now I'm back on, I'm sorry.
Oh, that's all right. I think the House stuff was free, but then go ahead, Mr. LeBecco.
Mr. Chair and members, yes, back up to House Section 18 and Senate Section 20. The Senate provision has money tied to it, but the House does not, and they don't conflict. So you could adopt the House language at this time, and then at a later date, when dealing with money, could adopt the Senate side.
We can do them both at the same time. Now, was there something about, and so we're going to hold on that. We'll just take it up. We have plenty of time. But, was this the one we talked about, residential hospice being added on the House side? Because the Senate was all prospective into fiscal 14, I think, and the House tried to work with current time, which is why they're compatible. And so, is this what I was talking about, residential hospice not being a required consultation at that point, too, right, Mr. Nelly?
Mr. Chair, I believe you did mention that, but I don't believe I have language to do that at this time.
Right, so maybe if you can just do me a favor and see if there's any cost in not having a consultation for people going to, was it residential hospice? It was something like that. That was another issue.
Mr. Chair, I think that's what we talked about.
So I'll take advice about that. That was you figure that they're going into a hospice. So. Anyway, so Mr. LeBeco, where are we at now?
Mr. Chair, members, we are on House Section 21 and Senate Section 23. This is similar to provisions up on, a few rows up, House Section 17, Senate Section 19. This is providing input for elderly waiver service rate limits and 24-hour customized living. Similar language, but not identical, and staff recommends the House.
Chair, I move the adoption of House Section 21.
Everybody understand that? All in favor, say aye. Aye. Opposed? Thank you.
Mr. Chair, members, next, House Section 21, Senate Section 24, on the individual service plan, the language is identical.
Mr. Chair, I move the adoption of House Section 22.
Everybody understand that? All in favor, say aye.
Aye.
Aye. Opposed? Thank you.
Mr. Chair, member, the next section, House Section 23, is a House-only provision regarding adult foster care license capacity, and this will be tied into our discussion later this evening.
Talking about that. Okay. Keep going.
House Section 24, a House-only provision. This is on developmental disability screening teams. This has no money, but it's a House-only provision.
Mr. Chair, are these provisions related, and if we adopt one, does that have any effect on the, for example, Section 25 and 23? Is that related to, can we adopt 24 without the other two is my question.
Mr. Chair, Senator Hann, yes, you can adopt House Section 24 and wait on House Section 25.
And, Mr. Chair, and I just want to understand, if we're adopting policy that only works in conjunction with the other parts that we're acting on, are we doing that, or are these things completely standalone?
This is a standalone.
Okay, then, Mr. Chair.
If staff wants to advise us, like we did the oncology thing, and that's a standalone study. That's, the deal is to do both, but pick up the others. Senator.
Mr. Chair, I move the adoption of House Section 24.
Everybody understand that? All in favor, say aye. 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 Opposed? Thank you. 25 is money.
Mr. Chair, members, the next section is House Section 25. It's a House-only section. It has to do with appeals and requires DD waiver recipients to appeal in writing if they have an appeal for services.
And that has money. So
Yes, Mr. Chair.
Thank you.
The next section is House Section 26 and Senate Section 25. It relates to the State Quality Council. It modifies the duties of the council, and there's no money attached.
Mr. Chair, I move the adoption of Senate Section 25.
Everybody understand that? All in favor, say aye.
Aye.
Aye. Opposed? Thank you.
Mr. Chair and members, the next sections are House Section 27, Senate Section 26. They're related to nursing facility replacement cost new per bed limits.
Mr. Chair, I move the adoption of House Section 27.
Everybody understand that? All in favor, say aye.
Aye.
Aye. Opposed? Thank you.
Mr. Chair, the next section is House Section 28, Senate Section 27. They're identical, and they're related to nursing facility rate adjustments for some moratorium exception projects, and there's no money attached.
Senator Hann.
Mr. Chairman, I move the adoption of House Section 28.
Everybody understand that? All in favor, say aye.
Aye.
Opposed?
Mr. Chair, members, the next section is Senate Section 28. This is a Senate-only provision. It removes a reference to a subdivision that's being repealed on the Senate side related to alternative payment demonstration projects, and there's no money.
Mr. Chair, I move the adoption of Senate Section 28.
Everybody understand that? All in favor, say aye.
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 Opposed? Thank you.
Mr. Chair, the next section is Senate Section 29. This creates a critical access designation for nursing facilities, and there is money attached.
So we'll have to pass on that.
For now.
Mr. Chair, the next section is Senate Section 30. It's a Senate-only section. It's related to nursing facility referrals for dual eligibles, and there is money attached.
We'll have to pass on that.
Mr. Chair, members, the next section is House Section 29. It's a House-only provision. This is related to the CAC, CADI, and BI assessments and reassessments, just allowing providers to have input.
Mr. Chair, I move the adoption of House Section 29.
Anybody understand that? All in favor, say aye. Aye. Adopted.
Mr. Chair, members, the next section is House Section 30, Senate Section 31. These are similar. They're related to the foster care issue.
We'll have to hold on that then.
Mr. Chair, the next sections are House Section 31, Senate Section 32. There are technical differences. Staff is recommending the Senate language, and this is related to community living settings and modifying the definition.
And we should do the amendment then, Ms. Pinelli?
Mr. Chair, yes, we could take up Amendment A-148 if you'd like to do that, if you have that in your packet.
Yeah, we don't have that amendment. Is that available, or do you want to?
Mr. Chair, I have a copy of it here that I could give to the page if we want to move on and come back to it.
We'll come back to it. Yeah, let's, you want to do it tonight? Let's do it tonight. Let's go make copies and make some for the audience. Ms. Pinelli.
Mr. Chair, the next section is House Section 32. This is related to CAC, CADI, and BI waiver appeals, requiring a written appeal, and it's got money attached.
It does.
Okay, let's hold on that.
Mr. Chair, the next section is House Section 33, Senate Section 39. These are similar, and they would also be included in the A-148 amendment that's being copied right now.
Okay, well, let's hold on that one then.
Mr. Chair, the next section is Senate Section 33, and this is related to the adult foster care language, and it's establishing a voluntary closure program.
And we'll hold on that.
Mr. Chair, the next section is House Section 34, Senate Section 41. The House is delaying the 1.67 contingent rate reduction, and the Senate repeals it.
We need to hold up on that.
And well, that's a small amount of money, like $22 million or something. Pocket me. Ms. Pinelli.
Mr. Chair, the next section is House Section 35, Senate Section 34. These are similar. There are a few differences. This is related to MSA shelter needy provisions.
Mr. Chair, I move the adoption of Senate Section 34.
Everybody understand that? All in favor, say aye. Aye. Opposed? Did you vote? Aye. Thank you. Ms. Pinelli.
Mr. Chair, the next section is House Section 36, Senate Section 35. These are identical, and they're related to the implementation of nursing home level of care criteria.
Mr. Chair, I move the adoption of House Section 36.
Everybody understand that? All in favor, say aye.
Aye.
Opposed? Thank you.
Mr. Chair and members, the next section is House Section 37 and Senate Section 34. This is also related to the contingent 1.67 rate reduction. The House is modifying it and the Senate is repealing it.
And we'll hold on that.
Mr. Chair, members, the next section is House Section 38, Senate Section 36, and this is modifying a rider related to the reduction of rates for congregate living for individuals with low needs.
And we're not going to be doing the House version, I know that.
I thought there were some language issues that we had to...
I think that was where I was trying to adjust spread the savings more evenly, and I'll not be pursuing that. So if you're worried about that, don't worry. And the Senate has...
We adopt this then?
Was the Senate, Ms. Pinelli, was the Senate something we wanted to do?
Mr. Chair, I think the Senate language is just requiring lead agencies to consult with providers to identify changes to reduce services while still maintaining the health and safety of people on the program.
Yeah, that seems like something we should do. Is that has no money? Is that right?
Mr. Chair, I'd move the adoption of House or Senate Section 36.
Does everybody understand that? What we're doing and not doing? Okay, all in favor, say aye.
Aye.
Aye. Opposed? Well, the Senate. There you go.
Mr. Chair, members, the next section is House Section 39 and Senate Section 37, and this is modifying a rider for local planning grants, and I believe we're recommending the Senate language, and there's no cost.
So we're way back on R7.
Yeah, right. And, Mr. Chair, I'd move the adoption of Senate Section 37.
Everybody understand that? All in favor, say aye.
Aye.
Aye. Opposed? Adopted. Ms. Pinelli.
Mr. Chair, members, the next section is House and Senate Sections 40. This relates to independent living services billing, and they're identical and there's no cost.
Mr. Chair, I move the adoption of House Section 40.
Everybody understand that? All in favor, say aye. Aye. Opposed?
Mr. Chair, the next section is House Section 41, and this is establishing the community first choice option, and there is money attached to this.
We'll hold on that.
Mr. Chair, the next section is House Section 42 and Senate Section 38. This gives the Commissioner the authority to reduce congregate care low needs reduction.
Yeah. And are we... Yeah. Actually, this is, I think MMB says we can't do this. Is that right? Rats. Okay, we'll have to hold on that. So. Read 42 and 38. We're trying to capture some savings and spend it again. Okay, Ms. Pinelli.
Mr. Chair, the next section is House Section 43. This is a House-only section. It requires the Commissioner of Human Services to submit amendments to the home and community-based waiver plans consistent with the definition of home and community-based setting that's in another section of this article, and there's no money attached to this section.
Mr. Chairman, I move the adoption of House Section 43.
Everybody understand that? All in favor say aye.
Aye.
Aye. Opposed? It's adopted.
Mr. Chair, the next section is House Section 44. It's a House-only section. It's requiring the Commissioner to seek an amendment for an exception to the Consumer-Directed Community Supports budget methodology, and there's no money attached.
Mr. Chairman, I move the adoption of House Section 44.
Everybody understand that? All in favor say aye. Aye. Opposed? That's adopted. Excuse me.
Mr. Chair, the next section is House Section 45. It's a House-only provision. It's a direction to the Ombudsman for long-term care to look into certain issues related to assisted living settings, and there's no money.
Senator.
Mr. Chairman, I move the adoption of House Section 45.
Everybody understand that? All in favor say aye. Aye. Opposed? Thank you.
And finally, Mr. Chair, the last section is House Section 46, another House-only provision. This is related to licensing PCA services. It directs the Commissioner of Human Services to study the feasibility of licensing those services, and there's no money.
Mr. Chairman, I move the adoption of House Section 46.
Everybody understand that? All in favor say aye. Aye. Opposed? Ms. Pinelli, we have your... What's the repealers, Ms. Pinelli? The repealers, are those tied?
Section 41.
House Section 41. What are they?
Mr. Chair and members of the committee, two of the repealers are related to the 1.67
Okay.
contingency reductions. We repeal those.
Repeal.
The other two are related. One is related to, I don't know
Yeah.
the statute, but one is related to the nursing, I believe the critical access designation,
Oh.
and the other is on the non-Medicare nursing facility requirements.
Now, we can go back, thank you. We can go back to section, the amendments are here, so we can go back to House 31 and 33, or whatever the corresponding ones are. Ms. Pennell, you want to walk us through?
Mr. Chair, the A148 amendment is amending Senate language. It would be Senate sections 32 and 39, and these are the sections related to community living settings and then the home and community-based settings. And this language is, I believe, just technical and was suggested by the department.
Mr. Chair, I move the adoption of the A148 amendment.
Everybody understand that? All in favor, say aye.
Aye.
Aye. Opposed? It's adopted, and did you want to
Chair,
move those two sections?
I would move the adoption of Senate Section 32 and 39 as amended.
Everybody understand that? All in favor, say aye.
Aye.
Aye. Opposed? Thank you. Very nice. That's the end of Article 4 for now. Just getting this stuff down. Article 5. This is, I'm not sure. Why don't you walk through it real quick, Ms. Pennelly? I think we're not going to be adopting it tonight.
Mr. Chair and members, House Article 5 is a House-only article. It's the Minnesota Children and Family Investment Program. This article is changing the name of the MFIP program from the Minnesota Family Investment Program to the Minnesota Children and Family Investment Program. The article also establishes a definition for child well-being. It modifies the list of information that must be presented at the MFIP orientation. It modifies the list of activities that count toward work under the MFIP program. It requires certain child development information to be posted in areas that are easily accessible to families participating in the program by employment and training providers. It modifies what must happen during the employment plan review, and then it provides an instruction to the revisor related to the change of the name of the program.
And Ms. Pennelly, what would the acronym for that program be if we were going to pronounce it?
Mr. Chair, members, I believe it would be McFIP.
Thank you very much. Okay, we're going to hold on those for now, so let's, thank you for, where's the drum thing? I don't know if he knew that. It's a parting gift from Representative Haas. Who's your favorite article? Articles, miscellaneous, the two miscellaneous articles.
It's Article 7.
I think there's no overlap on these two articles, is there? Article 6, Senate Article 5. Ms. Aves.
Mr. Chair and members, House Article 6 and Senate Section 5 are the miscellaneous article. The first 8 sections of this article are Senate-only provisions. Section 1 creates a moratorium on enrollment into the public employee insurance program.
And we'll hold on that for now.
Mr. Chair and members, Section 2 clarifies that a health plan company can use a network of providers and impose cost sharing for out-of-network providers and to use reasonable medical management techniques to determine frequency, method, treatment, or setting for child health supervision services and prenatal care. Is it an amendment? Mr. Chair, I believe there's an amendment for this.
We can amend it to get it in the order the Senate would like, I think, and then we'll be holding on the second.
849.
So for people who are just, it's fair game to amend either side as one body would like, and that's a custom. And so the Senate's going to be amending its own side, and then we'll be putting that section aside for now. Senator Hann.
And this is
Section 2.
Section 2.
it's fine.
Mr. Chair and Senator Hand, this is that amendment that takes out that one sentence that Gillette requested. So it's taking out the sentence.
And side by side, Ms. Kellner, what page are we?
R2.
Oh, yeah.
And it takes out the sentence starting 109.18. Starts there, that last sentence, that's removed.
Right.
Senator Hann.
And Mr. Chair, I would move the adoption of the 849 amendment.
Everybody understand that? All in favor say aye.
Aye.
Aye. Opposed? That's adopted. So we'll hold on that section now. Ms. Aves.
Mr. Chair and members, sections 3 and 4, Senate language, permit insurers to calculate premiums for continuation policies for an insured's former spouse and dependent children.
Thanks, and we'll be holding on that for now.
Okay.
Sorry.
Mr. Chair and members, Section 5 requires the Commissioner of Commerce to conduct an evaluation of any bill that's introduced or any amendment to a bill that contains a mandated health benefit proposal, and Section 6 requires a report to the legislature.
No, but these don't. But we're gonna have testimony on these at a later time, so we'll hold on this.
It's money, too.
And there's money. Oh, for two reasons we'll hold on. So that was
5 and 6.
5 and 6. Okay, yeah, I got it.
Mr. Chair and members, Section 7 requires the Commissioner of Commerce to evaluate each mandated health benefit currently required under Minnesota law or rule.
And that has money, and we'll be so let's hold on that.
Mr. Chair and members, Section 8 clarifies that a health plan that's authorized to be sold under Minnesota law can continue to do so.
And we'll be holding on that for now.
Mr. Chair and
Nothing
members.
personal.
Mr. Chair and members, Sections 9 to 13 of the Senate language is the nurse compact. House File 462 is the House version of that, and that's scheduled to be heard in Ways and Means tomorrow morning.
So we'll hold on that. I hope people didn't come just for Article 6, the way this is going.
And then if you turn to page 10 in the side-by-side, House Section 1, House-only provision, it adds marriage and family therapists to the list for mental health professionals for the State Advisory Council on Mental Health.
And is there an amendment for this?
Chris.
There is an amendment, but it is not a technical amendment.
Was that the LPCC? And we cleaned it up? Yeah, do that.
We need to.
We'll hold on that. Don't, it's fine. And maybe you can have Senate staff look at that.
Yes, sir.
Okay.
Section 2 of the House relates to Rule 25 assessments. The Senate has language in Senate File 2147 that's on second reading. If you choose to adopt this language, we would recommend using the Senate language because it is the correct language.
Correct? Not really. You shouldn't say it that way.
I think it's just fine.
Could you bring that as an amendment then? I mean, do we know, that'd be probably appropriate that we would have an amendment and adopt that. So you haven't got it with you, do you? Do you have your folder of correct Senate language with you? Or?
I don't believe I have that.
Big folder. You're often.
It's got
Anyway,
the
okay.
correct and the incorrect.
So let's, we'll act on that later.
Mr. Chair and members, House Section 3 and Senate Section 14 is related to Children's Day treatment providers. House and Senate are similar, but the Senate has the correct cross-reference information, and staff would recommend we adopt the Senate language.
I love my staff. Okay, Senator Hann.
Sorry, we're looking at
Make the correct
14.
motion.
Is this on
Senate 14?
Senate 14? Mr. Chair, I move the adoption of Senate Section 14.
Everybody understand the correct vote? All in favor, say aye.
Aye.
Aye. Opposed? Thank you.
Mr. Chair and members, House Section 4 is a House-only section. It adjusts the formula for allocating grants to counties to meet the needs of vulnerable adults and children.
This is a great section, Ms. Hayes, but actually, we're not going to be, the House would be not moving on this language this year. So it's meant to create some discussion, which is ongoing and I think productive. So thank you. Yeah. Oh. Okay.
We have the language.
Well, I don't
So which one is that?
Yeah.
That goes,
Ms. Aves, what was the Rule 25? Was that section, the language out of
Two.
Senate File 2147?
Senate File 2147, it was House Section 2.
Go ahead. You want-
Mr. Chair, I don't know what the right motion is. We don't really have an amendment, do we? Do we just adopt the language from Senate File
Ms.
2147?
White,
as
do you
amended?
want to comment?
Yeah, Mr. Chair and members, the difference between the House Section 2 and the language in Senate File 2147 is in the sentence, the House reads, "Nothing in this subdivision shall prohibit placement in a treatment facility." The Senate language says, "Nothing in this subdivision prohibits placement in a treatment facility," just grammatically.
I think the Senate would
Correct.
prefer the word shall, things like that, but why don't you move the Senate language as staff recommends?
Mr. Chair, I'd move the language recommended by staff to House Section 2.
Everybody understand that? So we're adopting the language of past Senate File 2147. All in favor of that, say aye.
Aye.
Aye. Opposed?
And then, Mr. Chair, I'd move the adoption of House Section 2 as amended.
Everybody understand that? All in favor, say aye.
Aye.
Aye. Opposed? That's adopted. Thank you very much. Ms. Aves, now we're down to...
Mr. Chair and members, House Section 5, it's the interagency coordination on homelessness. It requires the interagency council to give priority to reducing the number of children and military veterans who experience homelessness.
And we're going to hold on that for today.
Mr. Chair and members, House Sections 6 and 13 both deal with release of medical assistance liens.
And I think this is a great idea, but I think we're going to hold on it for today. And it has money, that's why. Okay. Thank you.
Mr. Chair and members, Section 7 relates to the collection of child care support. There is a small cost related to this.
Well, this is at $3,800.
I believe it is $4,000.
Yeah. Okay, we'll hold on that.
Mr. Chair and members, Section 8 is the White Earth Human Services Project.
And I think that, I think the MMB was unhappy with this section, as I recall. So I think we'll have to sit on that. So we'll try to respect our good agencies as we can. So it's a great idea, though, MMB. This is the way to go. Make sure this money stays in its right place. So if you're watching, oh yeah, and Commissioner Showalter, this is really a good idea here. So. All right, Ms. Aves.
Mr. Chair and members, House Section 9 is the licensing moratorium exception for foster homes for people with autism. this is similar, or the same as the Senate language in Senate File 1412, which is on second reading.
There's no money.
There's no money. So I don't.
Mr. Chair, I move the adoption of House Section 9.
Everybody understand that? All in favor, say aye.
Aye.
Opposed? Thank you.
Mr. Chair and members, Section 10 instructs the Commissioner of Human Services to develop an optional certification program for providers who demonstrate competency in working with individuals with autism.
So I think we're holding on that for now.
Mr. Chair and members, Section 11 is the chemical health model of care. The text is identical in the House and Senate. The only difference is that the Senate version has a different head note. It is currently in Senate File 2188. The staff would recommend, if you choose to adopt this language, that you use the House language with the Senate head note.
Where's the, do you know what this is in the Senate?
So moved. The status of Senate File 2188, what was the Senate file that has in the Senate? Where's that in the House?
Mr. Chair, I was just wondering where this Senate File 2188 was in the Senate process. I don't.
They said second reading.
Second, is that
in the Senate? We should adopt it. This is pretty important.
Did it pass? Yeah.
we have?
I think the Senate head note. House language. House language, Senate head note.
And the head note doesn't use the word navigator, I believe, Representative Wellington.
So moved. I think it's pretty popular all of a sudden. Okay, Senator Hann, do you want to move that?
Have we adopted the language, or do we need to move the language?
Well, if you could move to adopt Senate 11, House 11 with the Senate head note, which they will.
Right. Make it one motion.
Okay, it has passed. Mr. Chair, I move the adoption of House Section 11 with the Senate head note. That's clear enough instructions.
Everybody understand that? Whoever doesn't, all in favor say aye. Aye. Opposed? Thank you. Ms. Spinelli.
Mr. Chair and members, Senate Section 15 corrects a subtracting error from a rider in last year's base adjustment for the Administrative Services Unit.
That was not Senate language, by the way, Mr. Chair.
Oh.
That's
okay. Sorry, they just, anyway, so we should adopt that. Do you mind if we...
Mr. Chair, I would move the the Senate Section 15.
The Senate error correcting section, some correction of some incorrect thing. Everybody understand that? All in favor say aye. Aye. Opposed? Thank you.
Mr. Chair and members, the final section in this article that has not been discussed is House Section 12, Senate Section 16, encouraging the Board of Regents of the University of Minnesota to request funding for rural primary care training. If you choose to adopt this section, the staff would recommend Section 6, would recommend the Senate language.
Representative Huntley, do you have any, is that, this was your section, is that a good idea?
Chair, I will defer to Senator Lori.
Oh.
To what, to move it?
Oh, do you want?
To speak to it? I mean, they recommend.
Anything you want. Do you want to?
I recommend adoption of Senate Section 16.
Okay. Well, just that you were working on this, I think.
Yeah.
Oh. And it's been productive already. Is that right? I was just going to give you a chance to give a pitch about how it's been a productive amendment already. Just putting it in, how it's created discussion and improved benefits for the state of Minnesota. Okay, everybody understand that we're moving the Senate language, Section 16. All in favor say aye.
Aye.
Aye. Opposed? There being 2 ayes and no nays, the section. Yeah, that we're more excited about it than that. Oh, their appropriations. So is that the end of the language?
Mr. Chair, yes, it is.
Okay. Now we'll move to some testimony. Do you guys want a 5-minute break?
Yeah.
Okay, wait. Okay, we're not taking. You want to? Let's take 5 minutes, and I mean 5 minutes. We're in recess.